I was going to talk about Dr. Nataraja Pillai, but you already say everything about the legacy and the value and the light that are your family to India and to us. But I cannot pass this moment without putting this picture of Dr. Baby Natarajan and this one, as happy as he is still being. He is a light in every country and place and congress that he goes. As that little kid, he's still as happy. Before I start my presentation, I want to say something to all of you. And it's the immense appreciation and joy that I stand before you today to receive this prestigious medal here in India. Being recognized as the first woman from Latin America to achieve this honor is not only a personal milestone, but also a reflection of the dedication and hard work that so many have contributed so I can be here today. I'm so grateful, Dr. Natarajan. Thank you so much for everything you have done for me and for the world. And this moment to me symbolizes the importance of community. I want to thank the support of my family and my husband and my daughters so I can be here with you today. And also say the importance of friendship, mentorship, and say thank you to the patients because we are working for them. I accept this award and I'm thinking and reminded that the responsibility that comes with it. And I hope to leave a legacy to my daughters and for the future generation. So thank you so much. Telemedicine have given me a lot, because has given me the joy of knowing that if we say only one eye, sometimes we are saving a whole family. So by reaching those who cannot reach us, we have to continue working with perseverance and empathetic. Thank you once again for this incredible honor and for the support you have shown me today. I am truly grateful. And now I'm going to talk a general topic. I hope you like it and you understand what I'm trying to say. We are going to talk what we have to do if in the house we are having someone or we are also having an ocular trauma. And we want to start saying, what is an ocular trauma? An ocular trauma is an injury that can be caused by blow, cut, or burn, and that can cause damage to the eye or to the eyelid. The symptoms can be very different, very widely. Can be like a loss of the eyeball, or just can be an erosion of the surface. But we have some common signs in ocular trauma. We can have redness as the first sign. We can have tearing as a first sign. And we can have body sensation in the eye as a common and first sign. But in the severe cases, we can have vision loss, and this is very important to remember. We can have deformity or bleeding in the eye structure. Did you know that ocular trauma is leading cause of global ophthalmological morbidity and unilateral vision loss? This is very important. Injuries from ocular trauma are among the most common cause of blindness in young people. It is considered one of the most frequent ophthalmological emergencies. What can cause an ocular trauma? In the house, domestic, working without using protection, a fight, fireworks during a party, vehicle accident, sport, and in kids' play. We have different types of ocular trauma. The closed, as it says, the glove is closed. Only we have something that hurts the eye, but the glove is totally closed. This, maybe you can think, oh, it's closed, it's gonna be better. It can cause blindness too if we don't go to the ophthalmology soon. The injuries wearing pad cause inflammation, elevated ocular pressure, hemorrhages, and retinal detachment can occur too in closed. And in the open glove, which is more severe, and the risk of loss is very high. So what are the recommendations to avoid an ocular trauma? Use protection during a sport. I know it's not easy to wear a protection while you are doing a sport, but we should do it because we can prevent an ocular trauma. Supervise children when using sharp tools and toy weapons. Be careful during the celebrations when there are fireworks. We have a lot of kids, especially in the parties in December, that lost the eye, and maybe they were not playing with the fireworks. Sometimes they were just only seeing, but by the distance, they can be hurt. Use safety belts, proper storage of chemical products, and take precaution in the kitchen, and always, the most important thing, in all these scenarios, we need to use protective eyewear. What do I have to do if I have, or my family, my friend, or someone nearby have an ocular trauma? Do not touch, do not rub, or apply any pressure to the eye, because we do that, and we have an open glove, everything can come out. So we cannot touch or rub or apply pressure. Do not attempt to remove a foreign object if we have it. We need help. We need to go to a doctor. We cannot do it by ourselves, because things can be worse than we think in that moment it is. Do not apply any ointment, medication, and remember this, any home remedies. Some remedies that we think that are very good for the eyes can end bad and can make an infection of the eye, even perforation of the eye. So the best thing is not to put anything in the eye until an ophthalmology or a general doctor can help us. In case of chemical burns, the first thing we need to do is put a lot of water. The first thing, run for water. And place protective covering of gauze over the eyes and seek medical attention. What can we do? We can put a patch like this. This is from an hospital, but also this morning I show you, and I show you now again, in case you weren't here this morning, of things that you have in your house that you can use as a patch until you get to the doctor or to the ophthalmology. All of these, we have something like this in the house, and you can use it like this until we get help. If we have chemical in the eye, remember to put a lot of water. Where do we have to go? Go to the near medical center. Don't stay at home. Don't treat yourself. Sometimes we think, later I'm going to feel better. I'm going to put this drop that my neighbor told me or that my mom used to, and I am going to feel better. The best thing is go as soon as you can, so a specialist can tell you if you are okay, if you need something more, or if that eye drops that you have at home are the one that you need in your special case. This is a picture of what the fireworks can make. This was one of our patients. If you can see, he have multiple things in the eye, and he can only saw in that moment hands movement, and he also have foreign bodies inside of the eye because he was not waiting protection. We also have a lot of patients that works with fireworks from 20, 30 years, and they think they can manage, they know the business. And we have a patient with 30 years old that have lost both eyes and leave his children. He cannot see his children grow because he don't have now nothing in the eyes. He have no sight. So even though we think we know perfectly how to manage it, this is high risk always to use it. I don't know if the pictures are gonna be so rude, but this is, I made this video a few years ago when I was beginning doing videos. And what you can see is all the patients that we have at that moment with fireworks, ocular traumas. You can see how much it can cost to the eye, hemorrhages, this vitreous and anterior segment, open glow. A lot of things can cost. So the best thing is to wear protection, and if we can avoid it in the big parties, is the best for the safety of us and our family. Even though this that looks very innocent can cause a lot of damage to the eye. And with this video, what I want to show you is how protection can make the difference in our life. Look at this. Millimeters, centimeters to the face and the eye. So this is the difference. Sometimes we say, it's gonna be so fast what I'm going to do, I'm not waiting it, or I'm doing it soft, and something like this can happen. And we are not waiting for that. And when I'm showing you here, it's a glass. It's a pair of glass in an 11 years old baby. That was last week before I come here. And what I'm going to show you is how are we taking out this glass from a baby of 11 years old. Look at how big it is. So please, we need to supervise our kids. I know sometimes we don't have everything in our hands, but we have to do as much as we can, because not all the time we can do everything and we can manage everything, but as much as we can, because I'm going to put you again the video. It's an 11 years old baby. And look at the size of this glass. With this, what I want to say, prevention is the universal primary care. Promotion, education, talk to our families, our friends, our kids. Sometimes we feel that they are not listening, but they are listening. So we cannot stop or getting tired of saying people and doing the things that are right. Finally, I want to put you a short part of the video, because it's in Spanish, the whole interview, of a patient that he works make sport with people, training people. And one of the legs broke and hit in the eye. So he was really, really bad with a lot of high eye pressure, he was going to surgery, he stopped working, and that also impact a family. It's not only what you are having when you have an ocular trauma, it's how maybe you can impact your family. Someone is going to go with you to the doctor while you cannot go alone. Someone is going to be working for buy the eye drops you need. So it's not only you, it's so much involved around you when you have this. And he was telling us in this interview what happened to him and what he did to change that. He went to work again after months that we were giving him treatment, and what he wants to do now was teaching his alumni how they need to be working. And they, if you see, they are wearing protective glasses to make exercise. I know it's maybe difficult, but we can do it. So thank you so much. I am going to go back to Mexico with a heart full of joy and full of happiness of being here. And as I said in this morning, and I put you here once again, now I have not only 2 flags, I have 3 flags because I look like an Indian and I feel like an Indian. Thank you so much.
Muchas gracias. Tia? And so the last slide was for Elton, I think. The last video in the gym. Tia? You can come, Mary, you can sit here. Any questions you have to find out? Anybody wants to ask Mary anything on the talk of preventing eye injuries in children particularly while playing sports? Elton, you want to ask something or comment? You want the mic? Can you give one mic? Tia, you can come here. You have any questions, Tia? Okay. So my...
Hello.
Yes.
Good evening, Mary. Good evening.
Hello.
I was very intrigued with the gym mishaps that take place with the rubber band hitting the eye. I think so. Could you elaborate a little bit on what exactly happened?
What exactly happened?
Yeah, what happened when
He was doing exercise and this band broke and come into the eye. And you know what? The same thing happens a few months later with one of our doctors, which I work in ocular trauma. And when he came to the hospital and have all the eye with emergencies, what happened? And he said, well, we saw every day. So sometimes we think this cannot happen to us because maybe we are not doing too strong, but it's not in our hands sometimes. And we can maybe think that we are buying the best league to make the exercise, but it's not in our hands. So the best thing that we can do is protect.
Thank you.
You're welcome.